approaches which fulfill the rights of children with disabilities. Before we begin, I would like to make some housekeeping announcements. Please mute your microphone and turn off your video if you are not a speaker. Closed captioning will be provided throughout the event. The link is provided in the chat box and Donna is our captioner today. Please use the chat to interact with presenters for Q&A towards the end of their presentations. If you are having technical issues, please ask for tech support in the chat. This meeting is being recorded. By continuing to be in the meeting, you are consenting to be recorded. My name is Lieve Saba. I'm Program Specialist on Children with Disabilities, and I have the honor of being your moderator today. This session will be skillfully facilitated by Natcha Chujintararak and Maria Dolores Pico. In 2011, UNICEF launched a program in partnership with Australia's Department of Foreign Affairs and Trade, or DFAT, under the name REAP, Rights, Education and Protection. Its second phase, from 2015 to 2020, called REAP 2, had the overall vision to promote inclusive development approaches, which fulfill the rights of children with disabilities. Its geographical focus was on the demonstration countries of Papua New Guinea, Vietnam, and the Pacific Island countries and territories. That's how UNICEF divides the countries. Of course, Papua New Guinea is part of the Pacific Island countries and territories as it's seen in the Pacific. In 2020, UNICEF's Regional Office for East Asia and the Pacific conducted an independent evaluation of the REAP 2 program to identify lessons from the implementation at regional and country level that could be used to shape future disability inclusive programming. As you will hear later, this evaluation provided 4 recommendations for UNICEF towards breaking down the remaining barriers to inclusion and fulfill the rights of every child. This event is an opportunity for UNICEF EPRO to launch globally the REAP evaluation report undertaken by the expert team from Includovate. Today, you will also hear from several demonstration countries that will present on their promising practices. And the organization's global lead on disability will explain UNICEF's key actions to the mandatory management response to the evaluation. It is now my pleasure to introduce Robin Leven, Acting Assistant Director for the Disability, Indigenous and Social Inclusion section of DFAT's Multilateral Policy Division. Robin works in disability inclusive policy and programming in the Australian government's development program with a focus on the Pacific. Robin will brief us on the continued partnership with UNICEF and DFAT since 2011. Following Robin, Karen Hulshoff, Regional Director for UNICEF in East Asia and the Pacific, will deliver her opening remarks. Robin, the floor is yours.
Hello, everyone. I'm pleased to join this launch of the evaluation of the DFAT and UNICEF REAP partnership. The evaluation is an important milestone in the cooperation between DFAT and UNICEF in disability inclusive development. Australia remains a strong and consistent advocate for disability inclusion and rights in our engagement with the UN and other multilateral systems. And as Lieve said, this particular DFAT and UNICEF partnership extends back to 2011 and has a history built on shared objectives. DFAT chose to work with UNICEF in part because of its convening powers with partner governments and its experience working with government systems. And the evaluation has found that policy revisions and legislative changes supporting inclusion of children with disabilities are likely to be sustained, reflecting UNICEF's record of working with governments. REAP also supported UNICEF's disability inclusion leadership and advocacy in the UN system, including as an important ally for DFAT in the development of the UN Disability Inclusion Strategy. The strategy represents a significant step towards the realisation of a UN system that is fully inclusive of people with disabilities, and it provides a strong mandate for UNICEF's continued focus on disability inclusion. REAP 1 and REAP 2 were conceived as catalytic support for UNICEF to more effectively mainstream disability inclusion across its governance arrangements and programming, while also funding targeted disability inclusive programming in our Indo-Pacific region. It was a complex program with global, regional and national level components working across sectors, and the evaluation has acknowledged this complexity and provided a frank assessment of the program's successes and limitations. UNICEF is to be commended for its commitment to responding to the recommendations of the evaluation and for disseminating the good practice that REAP 2.
Thank you, Isaac.
You can admit maybe admit a hero.
And programming remains a guiding principle for DFAT's approach to disability inclusion, and we will use this evaluation to inform our own programming going forward. Thank you for the opportunity to participate this afternoon.
Thank you, Robin, for your commitment to the REAP program and to disability inclusion. May I now give the floor to Karen Hulshoff for her opening remarks.
Thank you very much, Lieven. Can you hear me?
Yes, we do. Yes.
Good morning, and for you, Robin, good afternoon. Ladies and gentlemen, really nice to be with you. Welcome to the launch event of the evaluation report of the Rights, Education and Protection Program. That launch event, that report, I should say, was prepared by Includovate. There are an estimated 60 million children with disabilities in the region of East Asia and the Pacific. Despite a stronger global regional frameworks being adopted in recent years, children with disabilities remain one of the most vulnerable groups to rights violations, to living in poverty, to challenges in accessing services or school, and to violence. UNICEF in general and our offices in East Asia and the Pacific region in particular have supported governments and partners to ensure that rights of children with disabilities are respected, protected, and fulfilled through various programs. As we heard from Robin Lieven, this was possible thanks to DFAT's funding and partnership to implement the REAP program, phase 2 that ran from 2015 to 2012. The evaluation report and this launch will provide us an understanding of the second phase of the REAP program, particularly what was well implemented and resulted in positive change in the lives of children with disabilities and their families, and which areas need some kind of reform, adjustment, or course correction. The report will help us to improve the relevance, effectiveness, efficiency, and sustainability of UNICEF's ongoing and future disability inclusive programming. Rosangela Berman-Bieler, UNICEF's global lead on disability, will speak about work that is already underway in response to the evaluation recommendations. Under UNICEF East Asia Pacific Regional Office reimagined strategic approach, we too will ensure protection of the rights and empowerment of the most marginalized children and their families. It is so important to realize that this evaluation was undertaken from start to finish during the COVID-19 pandemic and was one of the more successful UNICEF evaluations during that particular time. Innovation and flexibility was critical to enable data gathering, analysis, and associated work to be carried out effectively, although remotely. I would like to commend the Includovate team to be really innovative and the evaluation management team also for being able to deliver an invaluable evaluation despite multiple challenges. It is with immense pride that we, UNICEF East Asia Pacific, are sharing today the findings and recommendations of the evaluation. This report is already used in our decision-making for future efforts to secure the rights of children with disabilities and contribute to the core promise of the 2030 Agenda for Sustainable Development. Leave no one behind. Thank you for joining us today, and I look forward to very attractive, intense, and a good debate for the session. Thank you very much.
Thank you, Karen. Thank you also for acknowledging the REAP results on inclusive development in the region and the importance of the evaluation findings and recommendations for UNICEF regionally and globally. We will now hear from Christine Drutza from Includovate, who was the team leader for the independent evaluation. With an extensive career as community developer and researcher, Christy is strong on gender, child rights, and social inclusion. She has a passion for building partnerships and enhancing capacity for systems change that leads to social inclusion. Christy is the founder and CEO of Includovate and has been the research team lead to deliver various assignments, including the evaluation of the REAP program in 2020. Christy, the floor is yours.
Thank you. And good morning or good afternoon to everyone. It's my great pleasure to be able to present some of the results from this evaluation. It was a challenging time to complete such an activity, as you heard before. We sort of started, I think it was late March, and that was when, if you recall, the world was shutting down. Airports were closing very quickly due to COVID-19. And consequently, we needed to pivot the methodology in order to continue this important evaluation during all the bizarre times that were going on around us. Now, I can't actually see the presentation on my slide. Can anyone else see the PowerPoint? Ah, there it is. Thank you. Now I see it. Okay, so I'm going to just talk a little bit about the methodology and the approach we adopted. So next slide, please. Now, this looks a bit confusing, so don't worry. Basically, what we tried to do was use outcome harvesting, which is where we go through the interviews and we record what outcomes we heard that could be attributed to UNICEF's interventions. The other important part of this evaluation was to redesign or reconstruct the theory of change. So what you have on your screen right now is a little diagram to show how the reconstruction process of the theory of change fits in to different outcome harvesting stages. Anyone can email me for more information on the methodology another time. I'm going to skip through this quickly to get to the results, which is the most important part. So you can just see on the left, we had 56 key informant interviews, 47 completed surveys, online surveys. We did 8 case studies and we had 5 different theory of change workshops.
Christy, we lost your sound.
Hello?
Yes, now we hear you.
Fantastic. Okay, next slide, please. So again, a big slide. The point of this is to show you how we mapped the outcomes. So across the top in blue, there are 5 outcomes. Now REAP had 4, but during the outcome harvesting phase, we realized there was a whole category of outcomes that didn't necessarily fit perfectly under the first 4, but were very important, and that was around behaviour change. So we mapped that separately. So we counted each outcome that could be attributed to REAP, and so that's what the 17 in brackets, 11, 21, 24 and 8 in the blue means. Then you'll notice that there are different numbers in grey, orange, etc. that say 5, 4, 5. So at the top right of this slide is the scale. And this basically tells you the confidence we had in the evidence. Now, we needed to do this because of the remote nature of the evaluation, that some evidence was very strong, other evidence we couldn't quite get to, we couldn't see with our own eyes, for example. It wasn't heard as much. And so we felt the need to flag that to the reader of the evaluation so they could make their own informed choice about the extent of the evidence, rather than trying to hide something that wasn't quite as robust as something else. I'm going to go through each outcome now on each new slide. So next slide, please. So outcome 1 of REAP was disability inclusive legislation, policies and programs were promoted through enhanced advocacy, partnerships and an enabling environment. So this was, it's one of those result areas that do not at all reflect the amount of effort and relationship building that has to go into achieving changes to legislation and policy. So I'm just saying that at the outset. Then to mention that the Pacific Island countries and territories did not actually have outcome 1 in their log frame initially. But what led to this was outcome 4, which was around data, which I'll get back to in a minute. So 9 times the Pacific was able to identify results around outcome 1. And just to mention, sorry, I forgot to mention this demonstration model, which is why Vanuatu is flagged in the yellow there. REAP work with a demonstration model. Sorry, I have a little visitor who's just woken up. It's I'm based in Uganda and it's 7 a.m. or something here. So I'll get back to you later, darling. So in Vanuatu was a demonstration. So there's a lot of focus on the efforts, but the Pacific region, as Liva mentioned earlier, was sort of the overall focus. So you'll see Vanuatu mentioned specifically a few times. Then in Papua New Guinea, 4 times different outcomes were mapped. And as you can see, 5, 4, 5, that means the evidence was very strong towards these results. Outcome number 2 now, you'll see in the yellow star, it was mentioned 11 times. And actually, just to clarify too, it may have been mentioned more, but for us to link it back to UNICEF's efforts, that was what we were looking for here, to attribute the change to UNICEF. So outcome 2, improve coordination of sectorial programs at national and subnational levels to ensure participation and inclusion of children with disabilities and their caregivers. So rather than going into detail on the amount of times this was mentioned, because you can read that on the screen, I wanted to flag something that was revealed during the evaluation here, that there was an assumption that the coordination mechanisms were in place and therefore they could be built upon, where in fact a lot of those coordination mechanisms were either not functioning or not in place, or very flimsy. And so the results here weren't as much as some of the other outcome areas. Next slide, please. Okay, outcome 3. Outcome 4 is my favourite outcome, just to say, because obviously I'm a researcher and an evaluator, but also because there were 24 wonderful outcomes that were mapped there. So I'm just flagging that now, and I'll go back to outcome 3, which was around quality inclusive services for children with disabilities and their caregivers were integrated in sector plans and adequately resourced. So these 21 were mapped, but you'll see the evidence is slightly weaker, 3, 4, and 4, because we weren't able to go to these subnational areas and to really look in detail at the planning that was occurring and how integrated that planning was. But we have identified through the evaluation that this is a very important area, and it's picked up as a key recommendation. But also, too, I should say that you'll hear from different countries on what they've done in this space, which is wonderful. And the learning around this can really feed into a new phase programming, because it's the services that reach the children the most. They don't see the legislation. This is the part that really impacts upon their lives most directly. Outcome 4 is about data. And the reason why this is important is for a few reasons. One, knowledge is good in and of itself. 2, there's massive data gaps globally on children with disabilities. And this, the approach that UNICEF adopted was to use the Washington Group Child Functioning Model, or otherwise the Washington Group questions in the census. UNICEF also have a mix, which is a multi-indicator cluster survey, and some of these questions were embedded there. What the capturing of this data enabled was not only great relationships with other organisations such as SPC in the Pacific, but it helped policymakers and decision makers understand and see, if you'd like, how many children were missing out of assistance. So this led to some bigger changes in legislation and policy, such as new social protection programs being announced, new programs, and new policies being developed. So the data, once it's collected, UNICEF headquarters can help to plot that data with other countries. So it means the Pacific and Vanuatu and the other countries who collected data can now compare themselves to a global data set to see how people in their country fare compared to other countries. Next slide, please. So outcome 5 was the one that we as the evaluation team felt wasn't in the log frame, but kept coming up as being important. And this was around, oh, that's the wrong slide. It's meant to be behaviour change, sorry. For some reason, that's a copy and paste from the other one. So it's okay. I will just tell you that that's not the right outcome 5. Outcome 5 was around behaviour change. And it was mentioned a few times, not as much as the others. But one of the other recommendations coming from this evaluation was how important it was to remove barriers around discrimination for children. And part of that was also having children and their parents understand where to go for services and how to get non-discriminatory services and the rights of their children met. Next slide, please. Okay. So there's actually been quite a few lessons learned from REAP, and another lesson learned was the need to document these lessons more frequently and to have more country collaboration to share those lessons. It's not that the disability space is new, but it's that a lot of the evidence we might have on other sectors isn't in place or hasn't been documented to the same extent in the disability movement, particularly in the Pacific, where the data is patchy. So some of these lessons, obviously the data, it not only helps UNICEF talk about children with disabilities at the global level and to have countries such as the Pacific on the map, if you'd like, or in the presentations that they're giving when they go to other UN events and other global decision-making events. It also gives policymakers a sense of costing. They can do budgeting better when they know numbers, when they know the extent. The other thing that was something that happened, but by happening showed that it needs to happen more, which was around how early intervention and referral services need to link and how important they are to life chances later on. So by this, there were parents that we interviewed and others who knew there was something different about their child, but were unable to get a diagnosis, didn't know where to go. And then there were other parents who hadn't recognised there was anything different about their child until they got to school. And then they came out because of the learning outcomes that were different. So it's important that these referral services are far and wide, because rural areas have more poverty and less access to services than urban areas. And of course, children with disabilities live everywhere. So it's those rural areas, those remote areas where children face a lack of services and a lack of diagnosis. The other key learning was around linkages between health and education in particular, so that if a teacher identifies something, they can refer and have a connection to a health service provider in the community. Now, of course, a big part of this was training teachers to identify those differences and then knowing what services exist locally that they can refer to. Community-based protection is something that helps children in remote areas. So rather than them having to travel to a city area to get support, they can get it locally. And this is also something that helps to reduce discrimination. So it was a key lesson that needs to be built upon. Another part was around action learning. So Lieve, who you heard from before, was, I can't actually see, I always get Lieve's actual title incorrectly. I've got all these bars on my screen. She was the regional specialist for disability sitting in Bangkok. But in many ways, she was like a help desk to the different countries who were piloting and demonstrating new ways of working. And as such, and because the documentation isn't necessarily there around the lessons on disability programming, it was an action learning approach where UNICEF staff and their partners would trial something. They would speak to the regional specialist to get more feedback on the design, how it should work. They would give it a go and they would learn and reflect. And that this seemed to be a very effective way of improving and going further, let's say, with the programming that REAP2 could deliver. Next slide, please. Okay, so just some of the conclusions now. So it was a 4-year program, which doesn't seem to be long enough for the kind of normative discriminatory changes that are needed. So again, REAP2 was a systems change approach. So it tried to work upstream and by removing barriers so that children could become more inclusive. And it did that through demonstration countries to say, here's some evidence, carry it forward, or try that now in a different area or even in a different country. The data that was collected has led to many new policies and legislations, even in countries that didn't have policy and legislation as an outcome area. Partnerships were incredibly important, but as I mentioned when I spoke about the coordination mechanisms, the capacity or the strength of some of those mechanisms were not in place. The trust in some of the partnerships need to be built. particularly around the organisations of people with disabilities, OPDs, and how to work with them, to partner with them, and establishing that takes time. And with 4 years, you need to identify who's out there, who's interested, is there a mechanism, what stakeholders are there, then work to build that and build the trust in order to be able to strengthen these mechanisms and deliver services or consultations through them. The regional program specialist was key. I mentioned before sort of playing a help desk role. Well, it was more than that. But by having someone that was an expert, it gave many UNICEF staff the confidence to carry forward. And UNICEF employs experts. They have people with PhDs, years of experience in budgeting and economics. So for them to feel confident engaging in an area like disability inclusion that they may not have a background in, they did need that backing and that regional support to give them the confidence to go forward and try things, and to understand sort of like the best bet that the evidence was suggesting. REAP 2 has, for everyone here obviously, but it's created a growing interest in disability inclusion across the region. With the Sustainable Development Goals and the Leave No One Behind agenda, disability inclusion is certainly finally getting the attention that it needs in the development space. And this can't sort of die, if you'd like, within the region. It's not going to die generally, but a lot of appetite has been built. A lot of people heard about REAP 2, particularly a lot of OPDs and people living with disabilities in the East Asia and Pacific region. So they're looking to UNICEF to understand what comes next. So it's important to sort of capitalise on that momentum and carry it forward. Next slide, please. So as I sort of mentioned before, REAP 2's laid the foundation for more disability inclusive programming in East Asia and the Pacific, and particularly for children. What we realised from talking to OPDs and reviewing the documents in REAP 2 is a lot of OPDs exist or are run by adults with disabilities. Youth and children with disabilities don't really have an organisation as such. So there's a lot of work to be done in this area. And where REAP 2 was even more unique, I suppose, is around the cross-sectorial approach, which makes sense. If you have a child with a disability, they might need different education services. They might need to access health. They may want some rehab locally. Their parents might need some respite, or they might want some information they can't get from neighbours, for example, on raising their children. So there's a cross-sectorial approach that's needed when it comes to children with disabilities. And the closer that can get to communities, the more local, the more affordable, the more tailored, and the more accessible these services are. Early identification is a key entry point to overcome lifelong exclusion. The more speech therapy, for example, that children have access to, the better they are able to communicate later in life. The more education, the more income they can earn. Parents and communities also expressed their thanks and the new knowledge that they got from this program on how to interact with, raise, develop, fulfil, maximise their child's socialisation, to realise that the child had rights and that the child doesn't need to be kept away. It seems to be a very strong norm that children with disabilities are kept at home. So this program helped sort of overcome some of that ignorance or discrimination, but it's very strong that some people haven't encountered children with disabilities or disabilities before, so their ignorance is very high. Overcoming that will take time, and we suggest that a behaviour change campaign would be needed to help at that sort of local level and on a mass scale, so that people feel more confident interacting with children with disabilities, and to help children with disabilities be socially accepted. Next slide, please. So I'm not going to say a lot about recommendations because I'm out of time, but there were 4 recommendations. The first one had 3 parts to it, so that was a bit cheeky, I suppose, but they were related to how programming should be done differently. When I talk about systems change, it's a particular approach, but it's also it's about that enabling environment, right? And it's not necessarily, oh, if they need a school, we'll build a school. It's more about how can we work with partners. So we work at the local level, so parents demand or ask for a school. It's working with budget, so the money is there to build a new school. It's about working with government so they understand the need for that school. And it's about creating behaviour change at the local level, so children are not kept at home and are able to fulfil their rights and be educated. So you can see that it's quite a broad approach, but it's almost like you do a bit of tweaking here and a bit of tweaking there to get to that systems change. So that was definitely part of what a new program should continue to do. Adaptive management is, again, another sort of development approach, which is, if you recall, that some of the outcomes, like outcome 5 around behaviour change, was added in by us. Outcome 1 for the Pacific Island countries and territories wasn't in their log frame, but they had outcomes there. So all of this sort of means that sometimes windows of opportunity emerge in a country, and programs should take advantage of that. So an adaptive management approach gives that sort of more bottom-up sort of what's happening locally, where's an opportunity, and how can we learn from it, and where's the appetite to adopt that learning, as opposed to saying, here's what we're going to do, and then we do it. It's sort of saying, we're going to try some things, let's see what works, and let's run with that. So that's what an adaptive management approach is more about. It's about that action learning I mentioned earlier, and changing as needed with the environment and appetite and the evidence. Okay, sustainability is an interesting one. I think when it comes to disability inclusion, there's another level of ethics, if you'd like, or another level of responsibility that needs to happen, because these systems and the budgets for children with disabilities to be included isn't in place. What happens, for example, if UNICEF gives some budget support to government to train teachers in sign language, and then the program ends and children have been educated for the first time with sign language, and then a teacher leaves, moves country or moves area because she marries or who knows what, and then what happens to the child? How does that child continue to get educated? And there's that type of responsibility that needs extra care when you're looking at a sector like disability inclusion that is underfunded. So we're suggesting that at the very beginning of programs, that sustainability needs to be discussed with partners, as well as the endpoint, and that UNICEF can't sort of force other players to come in with funding. So what does that mean for this program and how it could be designed? Best case scenario is the program continues because government fund it, but that's not always possible. We have cyclones in the Pacific. We have COVID-19 that reduces funding. Next slide, please. Just wait for that to mute.
Yes, can people mute their microphones, please? Thank you.
So the last 3 recommendations were that I've mentioned this a few times, but the barriers need to be thought through. The discrimination and the attitudes that keep children excluded, even if services are offered, or that mean those services come with discrimination when they're offered. It's a big piece, but it can't be ignored just because it's big. And there are ways around behaviour change, mass media communications, for example. UNICEF has lots of experience in this space with things like water and sanitation, HIV, for example, that can be used to change attitudes. Expertise. Given Sustainable Development Goals and the LNOB, which is Leave No One Behind, it's important to have technical expertise such as a regional specialist available for government partners, for OPDs, for any other partner to draw down upon, but also regionalism. There is a lot of regional events like ASEAN and global events that require somebody who has an overview of a region, who can be there with the evidence, who can be there with the advice, who can sort of draw lessons at that regional level and not just sort of country by country. The last recommendation was around partnerships and to develop models that work with organisations of people with disabilities, OPDs. Often they're community-based, they're small, they may not have had an audit, they may not have even had any funding go through them. So what does that mean for how UNICEF works with these different disparate organisations? How should they connect them to government? What should the role be and what do OPDs want? And how involved are they in the program design? So that's a wrap from me. I'm sorry I had to go through quickly an awful lot of findings that I couldn't even scratch the surface of really here today. But I want to say thank you to UNICEF for giving Includivate the opportunity to do this evaluation. It was needed, and I really look forward to seeing the next steps. Back to you, Lieve.
Thank you very much, Christy, for a very insightful and maybe I should also say for a child-friendly presentation of the evaluation. Before we continue, if you have any question that you would like to put in the chat box, we're soon moving to a Q&A. But first, we're going to look at a short explainer video on the evaluation. I hope you have enjoyed the video. Let me know if you have noticed any cameo appearance. So now that you all have more information on the evaluation, on how it was conducted and on its outcomes, we would like to open the floor for Q&A. And I'm checking in the chat box. So please, if you have a question, you can submit it in the chat box. We'll give you a minute to type. Or if people would feel more comfortable speaking, you can also switch on your microphone.
Hello, Liva. This is Crystal.
Hi, Crystal. How are you
Hi,
doing?
good morning. I'm good, thank you. How are you?
Good.
Hi, I have a question. I was having some connection issues, but I wondered if you presented some good examples or practices from the country offices on disability inclusive programming that you can share. Thank you.
Oh, this is just coming up, Crystal. We're going to have examples from Vietnam, from the Pacific, and from Vanuatu. We will have 3 speakers coming soon.
Thank you.
Okay, I see a question from Megan Tucker. In the region, how will REAP results inform disability inclusive programming in the future? Megan, this is also coming up. We're speaking about the management approach that has global and regional components. We are definitely working on capacity building. That's one aspect as well. And also, as part of the reimagining strategy that we have chosen for the region, this is really about leaving no one behind. Just, I mean, we will discuss more, and you will also see in the presentations that are coming up what the specific strategies are in the country offices. We are going to cover as well the global management approach in detail. Now, if you have specific questions for Christy, we will also address them now. Megan, I'm happy to come back to your question as well later in the presentation when we have covered more of the next steps of the country programs as well as the global management response. Okay, let me see any more questions. We can always come back with a question for Christy in the next Q&A session that we will have after the series of presentations that are scheduled now. Okay, from Cecil in the Philippines. The recommendations from the study are very enlightening. We in the office have been looking for materials to capacitate our program staff in mainstreaming disability inclusion in our program. For example, we want our program staff to engage with more with OPDs. Is there a standard in the office? Standard staff training materials aside from the current one. The standard, I would say, has to do with the CRPD principle of engaging with OPDs. So that is our standard. We work with the Convention on the Rights of People with Disability and the principle. There is guidance in the making, Cecil. We are actually wrapping up a research on OPD engagement in the context of COVID and other humanitarian contexts. So that is definitely in the making. There's also more capacity building material in the making, as we will also hear from Rosangela Berman-Bieler, who will explain some key points of the global management response. I'm also happy to connect with you after the session bilaterally and elaborate more or respond to specific needs from the country office. Are there any more questions related to Christie's presentation? Okay, so always welcome to ask more questions in the towards the end of the session. But for now, let's continue with the program. And I would like to introduce you now to the presenters from the demonstration countries, who will be sharing promising practices on disability inclusion from their respective countries. We will hear first from Leslie Miller, Deputy Representative, on engaging young persons with disabilities in legal reform in Vietnam, followed by Talay Kama, Social Policy Specialist, who will talk about strengthening data on child disability in the Pacific Island countries. And last but not least, by Joe Simeon, Child Protection Officer, on the Early Interventions Program in the Community and Inclusive Education for Children with Disabilities in Vanuatu. Leslie, the floor is yours.
Thank you, Leva, and good morning, good afternoon, colleagues. As Leva said, I'll be presenting on our experience here in Vietnam in engaging children and young people with disabilities in legal review and reform processes. Next slide, please. So just a small bit of context. Vietnam became a signatory to the CRPD in 2007, but only ratified in 2015. In the meantime, it adopted its own law on persons with disabilities, but unfortunately before ratification. So the law has not been developed in conformity with the CRPD. It unfortunately adopts a very narrow and medical definition of disability, and as a result, there are major discrepancies between this law and other laws. We do have a national plan of action to support people with disabilities and our SDG implementation plan. Nevertheless, the implementation of all of these plans, laws, and policies remains challenging, particularly when it comes to access to services, and Christy mentioned that, and for us, especially in the rural and remote areas where the majority of children and people with disability live, as well as the limited public awareness and sort of charity-based approach to people with disabilities, and frankly, in many cases, discriminatory approach. And we have a lot of data that backs that up. We use the Washington Group methodology to do a national survey on people with disability. Next. So what was our action? One major piece of work was a legal gap analysis, which was maybe not your typical legal gap analysis because it included an analysis of implementation of laws and policies. And the aim was really to identify gaps and inconsistencies in the existing legal framework. It was a highly consultative process and took into account the voices and views of over 40 adults and children with disability. This made it very reality-based in terms of their concerns and views on how policies are actually implemented. So it really went beyond the legal words to the implementation. And we got really important feedback on access to services and especially awareness of rights and entitlements, both among people and children with disabilities, but also among service providers at the grassroots level who did not always know what people's entitlements or rights were. The second big piece of work was around evidence-based and participatory policy advocacy to influence a number of very key laws that have been adopted over the past couple of years. And here again, the aim was to ensure that the voices and views of people, young people, and children with disabilities were taken into account. So we had very active participation from representatives of OPDs, young people with disability and children with disability, who shared their views at workshops and pre-sessional consultations with both government and the National Assembly, resulting in improved understanding and appreciation for the perspectives of children and people with disability, but also further demand for more dialogue with people with disabilities. Next slide. So what can we say about the progress and results so far? I think we can safely say that the voices and views of children and young people with disability have influenced the content of these key laws. Firstly, the law on education includes an explicit mention of children with disability. It is aligned with international standards, both the CRC and the CRPD, and it includes concrete measures and indicators to measure implementation, such as the enrollment rates of children with disability in mainstream education. The Labor Code includes provisions on the protection of working minors and non-discrimination in the workplace, and the Master Plan on People with Disability has incorporated the views and recommendations of children and young people with disability. Next, please. So what have we learned along the way in terms of our promising practice, which relates again to participation? I think a few key kind of pointers or takeaways. The first being very practical one around setting up an appropriate venue that is accessible with appropriate technology, facilities, and equipment to really enable the full participation of all people and children with disability. And that wasn't always obvious here in Vietnam, so that did take a special effort. Secondly, especially when it comes to children and young people with disability, the importance of training, coaching, and preparatory workshops before they go into these policy settings full of adult lawmakers and policymakers. And I think that had a big impact and made a big difference in terms of empowering those children and young people to speak up. Thirdly was really the powerful impact that sharing personal stories and on-the-ground reality with these lawmakers who, as Christy was mentioning, may have never met a child or a young person with disability before. So that coming close and hearing the personal stories of those children and young people really had a big impact. And then finally, the importance of the feedback loop and mechanism for sharing back with the children and young people the results of their contributions. Finally, just a word about the next steps. Here in Vietnam, we're fortunate to be part of and have been granted a joint project under the UN Partnership on the Rights of Persons with Disability, a multi-donor trust fund. So we'll be working together with other UN agencies to continue this work in support of children with disabilities. And one important piece of that will be the creation of a platform for engaging young people to share their views and voices when it comes to their priorities and when it comes to policy making. And for us in Vietnam, that will be really critical and very timely because there will be revision of the law on persons with disability in the coming years. And this platform will serve as a great way to collect a broader range of views and recommendations from children and people, young people with disabilities. So that's it from Vietnam. I thank you, and I'm pleased to respond to any questions you may have. Over.
Thank you very much. Saleh, we're going to move to your presentation. The floor is yours.
Thank you very much, Liv. Can you hear me?
Yes, loud and clear.
Hi, Bulavinaka, everyone, and very warm greetings to all of you from the Pacific office based here in Fiji. I'm very happy to be presenting on behalf of our office to share a bit on the work that the office has been doing in terms of strengthening data on child disability here in the Pacific Island countries. In terms of contents, I will provide very briefly some background and then I'll move on to some key actions that we took, key results, lessons learned, and I'll end with next steps. So very briefly, in terms of background, there's been a lot of developments here in the Pacific region in the last few years, globally as a result of the adoption of the CRPD, and here in the region, a number of Pacific countries committing and ratifying the convention, as well as consensus at the highest levels in government. Recognizing the need to increase the work in the region on disability data research and knowledge. And all of these efforts culminated in the adoption of the Pacific Framework for the Rights of persons with disabilities, which was adopted in 2016. And there was a specific goal in the regional framework, which is Goal 5, focusing on disability research, statistics, and analysis. Next slide, please. So the support that came, the RIP support that we received was actually quite timely, and it enabled the office to design the initiative with 3 key objectives in mind. The first is the promotion of experience sharing in the collection, analysis, and use of the disability statistics. Of course, capacity building, which is critical for our partners and also for ourselves as development partners. And thirdly, contributing towards the improvement of the quality of disability data in the region, and specifically focusing on children with disabilities through census and national surveys. Next, please. In terms of the key actions that were taken, we're able to undertake 2 main actions, and the first was around systematically collecting and analyzing disability data, of course using the international tools that have been developed by the Washington Group on disability statistics, and its use in surveys such as the Demographic Health Survey, as well as national analysis capacity building workshops, which were undertaken. So if you have a look at the slide, this was done in a number of countries across the region. And secondly, through the RIP support, we were also able to contribute towards the enhancement of capacity building amongst the development partners, as well as with our government partners. And there was a regional training workshop on disability statistics that took place. We were also able to undertake exchange programs or South-South learning missions between the countries, as well as other capacity building workshops that were undertaken in the region. Next, please. In terms of the key results that were achieved, there were 2 main key areas. First is, as I mentioned, the collection of data for children with disabilities in the national census and surveys as a result of the adoption of the Washington Group questions. And this also contributed towards the generation of evidence or the production of disability reports or disability monographs, which were produced as a result of secondary analysis from census that were undertaken in a number of countries in the last few years. And the second key result is, of course, partnership and coordination. The Pacific being a small space with a few key players, the support from RIP enabled us to come together and provide support to the Pacific governments in a more coherent and structured manner. Next, please. And in terms of some of the lessons learned and areas that we've recognized where there are opportunities or potential for duplication, first is really around improved ownership of data and analysis. And this was, of course, as a result of a number of capacity building workshops that were undertaken with the national key stakeholders, both from government as well as stakeholders from civil society. Another key learning area is through the South-South learning or the knowledge exchange. And this was really a collaboration between UNICEF and our regional key partners, the Pacific Disability Forum, as well as the Pacific Communities Statistics for Development Division, which is based in New Caledonia. And thirdly, the use of the Washington Group questions, of course, which has been adopted as a core census module, and the inclusion of the Washington Group questions in a number of surveys in the Pacific, which of course will enable countries to have better disaggregated data for persons with disabilities. Next, please. And in terms of next steps and where we are, Christy touched on the MIX, or the Multiple Indicator Cluster Survey, which was launched in the Pacific, or rolled out in the Pacific in 2018, starting with Kiribati and Tonga. And there's a number of countries that have come on board showing commitment. A few countries, two countries actually, will be launching their reports shortly. Field work has been completed here in Fiji. And of course, we are seeing increasingly commitment as well from other countries in the region, such as the Federated States of Micronesia. And all of this work, of course, will provide updated, reliable, comparable data, which we hope will be used not only by governments, not just UNICEF, but also by other development partners in terms of informing what we do, key interventions, planning, budgeting process, and other support that we provide in the region. So I just want to end very quickly by recognizing some of the technical people that provided the support from our side. And I do want to acknowledge the Pacific Communities Statistics for Development Division based in New Caledonia. I also want to recognize our partners based here in Fiji, the Pacific Disability Forum, the Washington Group, and of course our colleague Stanley Govuya, who was instrumental in leading the support from our office on this end. So that's all from me. Thank you so much, and thank you for the opportunity.
Thank you, Tali, for your presentation, and also absolutely to recognize the efforts from the partner organizations. Joe, we are now going to listen to the presentation from Vanuatu.
Good afternoon and greetings from Vanuatu. My presentation this afternoon will be on early intervention program in the community and inclusive education for children with disabilities. In terms of the context, with Vanuatu's population, we have around 12% of the population with some form of disability. We have very limited data on children with disabilities in the education system. We also, in terms of the cultural and religious beliefs, it's very strong and it influences public perceptions of children with disabilities. Also, we have limited cross-sectoral coordination, especially for children with disabilities. Next slide. Okay, in terms of the accents, we have two main activities that UNICEF supported in Vanuatu from 2015 to 2019. UNICEF supported the Vanuatu Society for People with Disabilities to implement a community-based early intervention program, which actually targets parents. We have primary caregivers and communities, and the aim is actually to strengthen the support for children with disabilities, and at the same time to prepare them for mainstream primary school. Also, we have, so just going back to the last slide. So we have professional development for all the field workers for VSPD. There was a lot of awareness sessions and advocacy through cross-cultural initiatives, especially with several ministries within the government. We have Ministry of Education, Ministry of Health, and we have Ministry of Justice and Community Services. Furthermore, from 2019 to 2020, UNICEF also supported the Ministry of Education to implement a parent support program, which also include a module on supporting children with disabilities. And currently, the module is going through a review. And also, in terms of data, data on children with disabilities was collected for Vanuatu. And this was through the Vanuatu Education Management and Information System, FEMIS. Next slide. In terms of the progress, under the early intervention program, we have several things that actually took place. We have the early intervention classes that were implemented by VSPD. We also have home visits that were conducted. We have community sessions that were organized through the Parents Support Network. We also have a life skills program, which include training on childcare, child health, hygiene, protection, and also learning. Now, when we were looking at working with parents to increase their knowledge and confidence to help children, this was done through the Parent Support Network, also using the Child Protection Community Facilitation Package, and also the Parent Support Program that I actually mentioned earlier. We found out that there was stronger coordination between Ministry of Education as a result of the work that was done through RIP funding with Ministry of Health, VSPD, and also the Government Disability Desk and the Ministry of Justice. And data collected on children with disabilities in Vanuatu was led by the Ministry of Education and Training. Next slide. Some of the learnings to date, parents actually reported that there were major improvements in their child's communication, also behavior, and also in terms of their motor skills and life skills. Furthermore, children and parents and children have become more confident and outspoken. Participation in the early intervention program actually linked parents with the Parent Support Network, which actually maximize benefits for children with disabilities. And also partnership with the government of Vanuatu has also facilitated strong leadership and reinforced cross-sectoral linkages among stakeholders for joint advocacy and action for children with disabilities. And we have the establishment of the Teachers Inclusive Education Support Network, which was one of the most significant achievements towards building connection between early intervention and education in Vanuatu. Furthermore, data collection on children with disabilities is now available to inform the Ministry of Education and Training with a review of the inclusive education policy. Next slide. In terms of next steps, we are hoping that VSPD will be able to secure long-term financial investment either from the government or from other sources to continue provision of AI services and also to upscale the program in other provinces of Vanuatu. Furthermore, to also better integrate services with other sectors and partners, develop the new inclusive education policy, and also to advocate for increased financial resources for inclusive education and training, and also materials at kindergarten and primary level. And also finalize the revised parent support program and plan for scale up, as it was implemented in one province. But we are hoping that once the revised version is finalized, then it can be also implemented in other provinces of Vanuatu. And finally, make preparation to institutionalize data collection on children with disabilities using Open FEMIS, which is with the Ministry of Education.
Thank you very much to all presenters, especially not just for the presentation, but also for the many years of investments in the REAP program and in realizing the rights of children with disabilities. On the next slide, I would also like to acknowledge the work that's been done and documented on screening and early identification in Papua New Guinea, and the efforts to plan and implement a disability inclusive COVID-19 response throughout the region. These are also promising practices that are part of a publication that will be shared afterwards. Before we open another round of Q&A, we will first learn more about the evaluation management response, which is a main and formal way of ensuring that the evaluation evidence is used to improve UNICEF programs and policies and is a requirement by UNICEF's evaluation policy and executive board decisions. Rosangela Berman-Wheeler, Global Lead on Disability at UNICEF's headquarters in New York, will highlight a few action steps against the REAP evaluation recommendations. Given the time difference with New York, it's past midnight there. For her presentation, we will rely on recorded audio in combination with a PowerPoint. Natja, you can start. Thank you very much. Rosangela won't hear what I'm saying, but we definitely want to appreciate the presentation and the explanation of the evaluation management response. We would like to open the floor once more for Q&A. I know we are actually at our ending time, so we may only take 1 or 2 questions. Also, we will post the email addresses for Leslie, for Tale, and for Joe, in case you would like to reach out. This will be also included in the information that you will receive afterwards. Let's see if there is any burning question at this moment. We also have a more detailed documentation of the case studies, the promising practices, and that document is also something you will receive after this session. Okay, if no question for the moment, then let me ask my colleague Koroush Rafi, who has managed the RIP evaluation since joining the office as the regional advisor for evaluation exactly 1 year ago, to speak about key takeaways from the evaluation. Koroush, the floor is yours.
Thank you very much, Liv. I'm not sure I want to talk about key takeaways, given that we are over time, but I really want to thank all colleagues that have been involved. As you know, this evaluation took a big team to implement. We had the steering committee, we had the reference group, we had the management team, that Ivan, part of the management team, I think is already online with us. We had the evaluation team. So a big thank you to the cooperation of all colleagues that were involved, all the efforts that was put in, especially doing it during the time of COVID and through adaptive and different methodologies. That's really appreciated. And what we delivered against that is substantial. I really appreciate the team's work on that. Basically, I just want to say that you've heard some major important lessons learned, and we'll be sharing those with you. So good to take a look at it. One of the main issues that was raised is how do we work differently in different contexts, and then organization with people with disabilities might not have to go through the same selection criteria that our NGO and other partners will do in order to build the capacity and enhance that. And I'm happy to hear Rosangela was saying that they're working on that to implement that. So again, a big thank you to all colleagues and the participants. And I turn back to you, Lee.
Thank you, Koroush. Yes, we will wrap up, and I just would like to thank everyone for joining us today. Please note that in the coming weeks, we will be sharing the key resources highlighted during the event, and so look out for this in your inbox. The recording and slide deck will also be shared with you all. Goodbye for now, and wishing you a wonderful morning, afternoon, and evening. Thank you.
Bye. Thank you.
Thank you, Liv.
Thank you, Liv.
Thank you, Lee.
Thank you all.
Thank you very much.
Thank you, Nacha and Maria Dolores.